Welcome to our channel, Meditation and Health, an Art of Living. The motive of channel contents are to improve and goodness of life base and style of human beings. In this video we will talk about the meditation concepts and stress, anxiety, depression, pain, self-concept, well-being and effects of meditation on health. Meditation and Health, an Art of Living. Okay dear friends, let's start with meditation concept. Your brain develops through neural connections. Neurons, the information processing cells in your brain, connect to make neural pathways, which are responsible for your thoughts, sensations, feelings and actions. This same process happens when you meditate. Science and technology only improve the human lifestyle only with physical level, although the spirituality or adhyatma practice makes your life better and move your life for advanced level and above the physical state of your mind and body. Yoga and meditation are only ways to attain spirituality. Through devotional practices of meditation or yoga we can attain the zenith of spirituality or spirituality, that which is related to self, which includes mind, body, and energy, is called spirituality, and live life with a good understandings of humanity. Various religions follow and practice the meditation in so many ways with their cultural activities. The earliest records of meditation, dhyana, are found in the ancient Vedic texts known as the Vedas, and meditation plays a salient role in the contemplative repertoire of Hinduism and Buddhism. In pre-modern and traditional Hinduism, yoga and dhyana are practiced to realize union of one's eternal self or soul, one's Atman. In Advaita Vedanta this is equated with the omnipresent and non-dual Brahman. Since the 19th century, Asian meditative techniques have spread to other cultures where they have also found application in non-spiritual contexts, such as business and health. New Age meditations are often influenced by Eastern philosophy, mysticism, yoga, Hinduism and Buddhism, yet may contain some degree of Western influence. Meditation practices effectively reduce stress, anxiety, depression, and pain. Enhance peace, perception, self-concept. One's self-concept, also called self-construction, self-identity, self-perspective or self-structure, is a collection of beliefs about oneself. In general, self-concept embodies the answer to the question who am I? Self-concept is distinguishable from self-awareness, which refers to the extent to which self-knowledge is defined, consistent, and currently applicable to one's attitudes and dispositions. Self-concept also differs from self-esteem. Self-concept is a cognitive or descriptive component of one's self. For example, I am a fast runner, while self-esteem is evaluative and opinionated. For example, I feel good about being a fast runner. Well-being, also known as wellness, prudential value or quality of life, refers to what is intrinsically valuable relative to someone. Quality of life, QOL, is defined by the World Health Organization as an individual's perception of their position in life in the context of the culture and value systems in which they live and in relation to their goals, expectations, standards and concerns. So the well-being of a person is what is ultimately good for this person, what is in the self-interest of this person. Well-being can refer to both positive and negative well-being. In its positive sense, it is sometimes contrasted with ill-being as its opposite. Stress, either physiological, biological, or psychological, is an organism's response to a stressor such as an environmental condition. Stress is the body's method of reacting to a condition such as a threat, challenge or physical and psychological barrier. Stimuli that alter an organism's environment are responded to by multiple systems in the body. In humans and most mammals, the autonomic nervous system and hypothalamic pituitary adrenal (HPA) axis are the two major systems that respond to stress. Anxiety is a feeling of uneasiness and worry, usually generalized and unfocused as an overreaction to a situation that is only subjectively seen as menacing. It is often accompanied by muscular tension, restlessness, fatigue, inability to catch one's breath, tightness in the abdominal region, and problems in concentration. Anxiety is closely related to fear, which is a response to a real or perceived immediate threat. Anxiety involves the expectation of future threat, including dread. People facing anxiety may withdraw from situations which have provoked anxiety in the past. Depression is a state of low mood and aversion to activity. May be mental and behavioral disorder. The experience of depression affects a person's thoughts, behavior, motivation, feelings, and sense of well-being. The core symptom of depression is said to be anhedonia, which refers to loss of interest or loss of feeling of pleasure in certain activities that usually bring joy to people. Depressed mood is a symptom of some mood disorders such as major depressive disorder or dysthymia. It is a normal temporary reaction to life events, such as the loss of a loved one, and it is also a symptom of some physical diseases, and a side effect of some drugs and medical treatments. It may feature sadness, difficulty in thinking and concentration, and a significant increase or decrease in appetite, and time spent sleeping. People experiencing depression may have feelings of dejection, hopelessness, and suicidal thoughts. It can either be short-term or long-term. Pain is a distressing feeling often caused by intense or damaging stimuli. The International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience associated with, or resembling that associated with, actual or potential tissue damage. In medical diagnosis, pain is regarded as a symptom of an underlying condition. Pain motivates the individual to withdraw from damaging situations, to protect a damaged body part while it heals, and to avoid similar experiences in the future. Most pain resolves once the noxious stimulus is removed and the body has healed, but it may persist despite removal of the stimulus and apparent healing of the body. Sometimes pain arises in the absence of any detectable stimulus, damage or disease. Pain is the most common reason for physician consultation in most developed countries. It is a major symptom in many medical conditions, and can interfere with a person's quality of life and general functioning. Simple pain medications are useful in 20% to 70% of cases. Psychological factors such as social support, hypnotic suggestion, cognitive behavioral therapy, excitement, or distraction can affect pain's intensity or unpleasantness. In some debates regarding physician-assisted suicide or euthanasia, pain has been used as an argument to permit people who are terminally ill to end their lives. Publishing in the Journal of the American Medical Association, identified 47 studies that qualify as well-designed and therefore reliable. Based on these studies, they concluded there is moderate evidence that meditation programs can reduce anxiety, depression, and pain, but no evidence that it is more effective than active treatments such as drugs or exercise. Another major review article also cautioned about possible misinformation and misinterpretation of data related to the subject. Research on the processes and effects of meditation is a subfield of neurological research. Modern scientific techniques, such as fMRI and EEG, were used to observe neurological responses during meditation. Concerns have been raised on the quality of meditation research, including the particular characteristics of individuals who tend to participate. Meditation lowers heart rate, oxygen consumption, breathing frequency, stress hormones, lactate levels, and sympathetic nervous system activity, associated with the fight or flight response, along with a modest decline in blood pressure. During meditation, the oxygen consumption decrease averages 10 to 20% over the first 3 minutes. During sleep, for example, oxygen consumption decreases around 8% over 4 or 5 hours. For meditators who have practiced for years, breath rate can drop to 3 or 4 breaths per minute and brain waves slow from alpha waves seen in normal relaxation to much slower delta and theta waves. Meditation can improve controlling attention, as well as self-awareness. The psychological and physiological effects of meditation have been studied. In recent years, studies of meditation have increasingly involved the use of modern instruments, such as fMRI and EEG, which are able to observe brain physiology and neural activity in living subjects, either during the act of meditation itself or before and after meditation. Correlations can thus be established between meditative practices and brain structure or function. Heartfulness meditation is a heart-centered meditation practice. The idea behind heartfulness meditation is to connect to ourselves and create an experience that brings us a sense of peace and calm. This process often includes sitting quietly and tuning into your heart. When your mind wanders, you are to bring your focus back to tuning into your heart. Research on heartfulness meditation has shown to improve sleep quality, decreased burnout, and reduce stress. A study published by India's National Institute of Mental Health and Neurosciences using high-density EEG showed the prevalence of enhanced occipital gamma waves among experienced heartfulness meditators. Gamma waves are believed to be associated with perceptual clarity, consciousness, emotions, emotional regulation and elevated concentration. In the last only I am saying that a regular meditation practice will improve your health, lifestyle, social status along